Hello, Tom LeVecchia here with New Theory Podcast, and we are podcasting live from LA here at Pump in West Hollywood at LA Pride. We are here with the godfather, yes, the godfather of male plastic surgery, Dr. Douglas S. Steinbrech. Dr. Steinbrech, how are you doing today?
I'm so excited to be here, and I'm excited to be in LA, and I'm excited for what we're doing today.
New Theory is very happy to host you. So we like to start off, give us your formative years. Where did you grow up? And just start off what made Dr. Steinbrech Dr. Steinbrech.
I grew up in Iowa, a really small town. I loved it. Then I did my education there. Moved to New York, did my training at NYU. Really fell in love with plastic surgery, fell in love with the men's aesthetics, and just moved. It just exploded from there.
So you started out in New York, right? So you hung your shingle in New York. You started killing it, a very successful practice, right? And that was Male Plastic Surgery in New York. That was the first ever plastic surgery website for men. Right. So we get that, right? But you decided to come to LA and roll the dice. Why?
Yeah, we decided to come to LA because in New York, really, the website for men just exploded. And we realized that people weren't educating to men, people weren't telling men about these great techniques. And in general, the plastic surgery community was not really educating men, not doing surgery for men, and not helping them out. So we found that if we did it in New York, that they would follow, and they did. And so we cut and pasted it, we brought it out to LA, and we're like really excited how it's exploded in Beverly Hills.
All right, so he tested the waters in New York. He decided to understand the proof of concept, expand to LA. So we know what women get, right? They get breasts, butt lifts. What are some of the procedures that men decide to go under?
Men do a totally different thing. Men want to look good. They want to look ripped. They want to have a better pecs. They want to have a better glute. They want to have ripped abs. So I do a thing called body banking where I take all the bad fat out of the bad areas. I sculpt the abs. I sculpt the glutes. I sculpt the pecs. And then I put it in to give more volume to the biceps, the shoulders, the pecs, the abs, the calves, everything.
All right. So they get, butts, guts?
Yeah. They get pecs, butts, and guts.
Pecs, butts, and guts. I love it. All right. So from the business aspect, you're in LA, you're in New York. What options do they have now? Can they Skype you? What can they do now?
They can find me at in New York by Skype. They can see me. They can come into the office. They can fly in. We have an amazing fly-in program. And now we brought that all to LA, so we're in Beverly Hills. So basically everyone from the West Coast, west of the Mississippi, they come from anywhere west, really. Anywhere from Ohio. On the East Coast, it goes to New York, or on the West Coast, anywhere from Arizona on over. From up in Seattle, they come down to LA.
So in terms of scalability, so you're in 2 cities bi-coastal. Where else do you see yourself going?
Well, we're looking at Florida. We're looking at Miami, Fort Lauderdale, where a lot of our boys are, and also in Palm Beach. And then really we want to hit it in Chicago. So Chicago is a great opportunity for us. I grew up in Iowa. I'm an Iowa boy. I want to go back to the Midwest. And there's a huge opportunity for us. And there's a huge opportunity for all the guys out in the Midwest in Chicago.
Love it. So we're here in LA, Pride Week. We're celebrating. What does it mean to be here during Pride?
I'm so excited for Pride because I really feel like the gay men. I'm a gay guy. I have a beautiful husband and a beautiful son and a beautiful family. And I'm really excited for what we can do for our group. For so long, this group has been neglected by the Plastic Surgery Society, and I think we're all going to bring them back. We have a great society. We have great people that are now starting to get it for men, and they all want to bring it home for all the gay guys out there. And so I'm so glad for ASAPs and ASPS that they now understand gay men are out there, and gay men need it just like men and women. And all the women out there, so I'm excited to be here.
Absolutely. We are live streaming also from Male Plastic Surgery LA and also from Hot Guys LA. Any questions at any phone in or any call in? What is the average cost of getting a six-pack, Dr. Steinbrech?
So I developed a new thing called Silicone Sixpack. And what that is for guys that really have no fat to inject into their abs, because I also do that. is we need to put tiny little biscuits or silicone abs into each individual six-pack, and you can call our office for it, but it runs in a range anywhere from 6 to 15,000, depending on what other things we do, and those are the Silicone Sixpack.
All right, one thing you talk about is, listen, everybody says, hey, just hit the gym. But people hit a genetic wall. Talk to us about that.
Absolutely. Everyone says just go to the gym. Usually why plastic surgeons tell you that is because they don't know the techniques or they haven't developed the techniques to do what you need to have done. I've worked very hard to develop these techniques, and I understand men because I am a man and I understand men's bodies. And I go to the gym and I realize you hit that genetic wall. So what you need is you may need a small implant in your chest, in your bicep, in your tricep, in your calves, and we do that. We have silicone muscle gel implants that hit every single muscle group. So if you're going to the gym and you're just killing it with your chest, you're just killing it with your glutes, you're just killing it with your legs, but then you're deficient. You're deficient in some area, either in your shoulders, your biceps. Usually it's the chest. People just cannot get a good chest. And in those areas, either the chest or the glutes, we can really do a great job. Or biceps, shoulders, calves, really any area.
Awesome. So we had the honor of having Dr. Douglas S. Steinbrech, the godfather of male plastic surgery. Any parting words to our New Theory millennials?
No, just glad to have everybody here. Millennials are a big part of this. Millennials are realizing how important it is to look good and not let yourself grow too old, too early, but to look natural. So millennials are like a great group of people. They really understand this.
Beautiful. Dr. Steinbrech is very busy. We're happy to have you on, and this is a New Theory podcast. Signing off.